And finally, more than half the country has received at least one coronavirus vaccine dose. Well done. Slowly, more and more Americans are getting their shots. And while the pace has dropped significantly, more than 1 million people are still getting vaccinated each day. And if the current rates hold, we could reach the threshold for herd immunity in the country by late September or October. Of course, discussing this as though it matters anymore is a little bit weird. The country has already reopened. It didn't wait for herd immunity to be reached to get people back to work. Children under 12 still can't even be vaccinated, yet we're back to normal. Roughly half of all unvaccinated adults reported that they didn't get a shot yet because they're concerned that they can't get time off work to deal with the side effects. And those concerns were found most among Black and Hispanic workers. And globally, there's still no movement on a proposal before the World Trade Organization to waive COVID vaccine patents to allow poorer nations to manufacture shots on their own. Negotiations among nations resumed on Monday, but no deal was reached, as much of Europe continues to hold out on supporting a waiver, and the U.S., while paying lip service to a waiver, hasn't really pressured other nations to join along. As long as most of the world remains unvaccinated, the pandemic will never really end. It may even get worse if allowed to mutate into strains resistant to current vaccines. Countries that have been doing a good job containing the pandemic so far are now dealing with renewed outbreaks. For example, in Vietnam, which has boasted some of the lowest infection and death rates in the world, numbers are climbing up. The infections are tied to a Christian mission in Ho Chi Minh City, but unlike in the US, which never really went into lockdown to deal with the virus and just sat there and watched as hundreds of thousands of citizens died, Vietnam is already taking drastic actions to tamp down on the outbreak. They put a lockdown in place and are testing 100,000 people daily and are quarantining those infected. When you're not serving the interests of capitalists, you can actually fight the virus. MMN's newest correspondent, Luna Oi, has the story all the way from Vietnam.
Xin chào, hi there. This is Luna Nguyen reporting in to Min's Morning News from Da Nang, Vietnam.
As we all know, COVID-19 has been disrupting our lives over a year now, having already killed 3.4 million people and infecting many millions more. At times, it might seem overwhelming.
But luckily, we have some examples of hope in the world, such as the ongoing battle against COVID-19 here in the Socialist Republic of Vietnam.
Since the outbreak of COVID, Vietnam has proven that with the right measures, even a poor developing country in Southeast Asia can halt the spread of this deadly disease. To date, there have only been about 5,000 cases here in Vietnam and only 42 deaths. Currently, Vietnam is dealing with a new outbreak, the fourth outbreak so far in Vietnam. But government officials are confident that this one will be contained as well within a matter of weeks. So, how does a poor country like Vietnam contain COVID and keep our death count down to just 42 when the wealthiest nations in the world have suffered hundreds of thousands of deaths and failed to contain the disease? Well, the answer is very simple. Vietnam puts human lives before capitalist profits. As you know, in December 2019, a new strain of coronavirus was reported in Wuhan, China. Unlike most countries, Vietnam immediately began making serious preparations for the major epidemic that was about to break out.
Trong đó có cái mốc là đúng giao thừa thì chúng ta thực hiện cách ly y tế bắt buộc, là quốc gia đầu tiên trên thế giới thực hiện biện pháp này. Và lúc thực hiện cái này cũng phải lý giải, cũng phải thuyết phục, kể cả với Tổ chức Y tế Thế giới. Vì chúng ta đã thực hiện mức cao hơn mức cảnh báo của Tổ chức Y tế Thế giới. Và sau này thì chính Tổ chức Y tế Thế giới cũng phải nói rằng những giải pháp sớm hơn và cao hơn mức khuyến nghị của Tổ chức Y tế Thế giới mà Việt Nam đã quyết định là hết sức đúng đắn.
Just 1 month after China's first announcement about COVID, we had our first COVID-19 patient. This should not be surprising, considering that we share a border with China, and at that time, we had thousands of international travelers coming in and out of Vietnam on a daily basis. Fortunately, Vietnam's government was able to immediately implement a track and trace system with the intention of accounting for every single person who may have had physical contact with the patient zero. Then we implemented a mandatory quarantine for anyone who may have been exposed to the virus. People under quarantine received everything for free: free shelter, free food, free COVID testing, and most importantly, free healthcare treatment. But that's not all. We also had massive collective campaigns to take the virus very seriously. Free masks was distributed, and any business caught price gouging masks and other medical supplies had their business licenses permanently revoked. The Vietnamese people and government worked together to make sure the disease was contained. Most importantly, the government of Vietnam has shown a firm willingness to sacrifice our economy to save human lives. Strict lockdown shut down all businesses except for the most essential services like grocery stores. It meant sacrificing millions of dollars in trade, but we persevered because we knew that if we didn't take the virus seriously, we would be in trouble. After all, at the outbreak of COVID, Vietnam had a population of 97 million people and only 250,000 hospital beds.
Through all of these actions, we were able to contain the virus in just 5 weeks.
Chúng ta phải bảo vệ tính mạng, sức khỏe của nhân dân là quan trọng, chứ không phải sản xuất kinh tế đâu. Tôi đã nói, chúng ta hy sinh quyền trong ngắn hạn về kinh tế để chúng ta bảo vệ sức khỏe, tính mạng của nhân dân. Cho nên cái việc một kinh tế này đó là muốn phát triển thì trên cơ sở bảo vệ sức khỏe nhân dân, chứ không phải là vì kinh tế mà chúng ta bất chấp những vấn đề về tính mạng sức khỏe của nhân dân. Chiếc lò xo bật lên mà chúng ta đang nói đây đó, khi mà dịch bệnh cơ bản đã giải quyết ở Việt Nam, và chúng ta tin tưởng và hy vọng như vậy. Còn khi có bệnh tật thì chúng ta phải cương quyết xử lý đồng bộ để ngăn chặn.
In March, when a second COVID wave broke out, the government took the same actions as before. Plus, we immediately stopped exporting rice. Remember, Vietnam is number 2 country on earth in rice exports after India. Rice is a huge source of income for Vietnam, but in order to assure food security and to protect our people, we stopped exporting it. This, coupled with our long-standing price stabilization programs, as well as mutual aid and government food distribution, has meant that nobody has had to go hungry because of the pandemic.
During the first lockdown, Vietnam also provided stimulus checks to poor people, disabled people, and unemployed people for 3 months.
Another important aspect of virus containment has been self-sufficiency for Vietnam. We are all too familiar with imperialism, and our government knew from the beginning that issues like vaccine imperialism would be a problem. That's why Vietnam worked very hard to develop our own test kits very early on. We have had domestically developed and produced test kits since March last year, and now we are close to finishing testing on 2 out of 4 different domestic vaccines, and we plan to have 20% of our population vaccinated by the end of this year.
This may seem slow compared to other more wealthy countries, but we are taking our time to fully test our vaccines. We have the luxury of extra time since we have been able to contain the virus so well.
At the time of this recording, Vietnam is going through a brand new wave of COVID-19. Sadly, no matter how well we deal with the virus domestically, it is still uncontained in most of the rest of the world. So, unfortunately, it has slipped back into our country despite mandatory 3-week quarantine for anyone entering the country.
This is the worst outbreak yet, as we are having 100 new cases every day. That may seem low compared to most of other places on Earth, but by our standard, it's pretty bad. But the fight goes on. Usually at this time of day, there are hundreds of vehicles on this road, but as you can see, things are mostly quiet. Unnecessary services such as bars, karaoke, and tourism are now closed. People are back to wearing masks, and schools are totally shut down. Here in Da Nang, only a few residential areas like this are being completely locked down. But in Hanoi, Ho Chi Minh, Bắc Ninh, or Bắc Giang, where there are more community cases, stricter measures are being taken citywide.
And of course, there are no anti-maskers here in Vietnam, no clashes with police. In fact, you barely even see any police on the streets during these lockdowns. It's a tough situation, but at the same time, Vietnam is very peaceful right now, and the whole country is fighting this pandemic together in solidarity.
This is what happens when you have a socialist people with socialist values and a competent government that puts human lives before capitalist profits.
Speaking as a Vietnamese citizen, I personally believe that we are doing our best to contain the virus, and I strongly believe that we can do it again. For now, please stay safe, stay well, and show solidarity from the Vietnamese people to all our comrades around the world. If you want to learn more about Vietnam, you can check out my channel Luna Ơi right here on Means TV.